What we're going to talk about is the World Health Organization's communication about pandemic and what the definition is. And the reason why I mention this to you is because you think that we would have this figured out by now. It's the World Health Organization. Very smart people, don't get me wrong, they're doing the best they can. But I need to show you something that rather troubles me quite a bit, I should say it that way. A few things, but the things that I primarily have a problem with are definitions of things that we should already know in advance. Mortality rate, key one. You think we'd know what mortality rate really means, okay? Believe it or not, they're giving you a rate of all the people that are already sick. Not the people that have died or been cured, but the people that are still sick. Okay, this is not how you calculate mortality rate, but that's what's being told to you. So aside from that, let's talk about what's a pandemic and see the confusion and see the political response that you get versus an accurate response, something that's defined by a global standard, something that you have to measure. It's scientific. It either is or it isn't. I just want you to watch the response. And we'll pause the video and we'll go through and I'll show you different segments and I'll elaborate. Here it goes.
If you can, yes, thank you.
Good afternoon. Tomohiro Deguchi with Kyoto Japanese Newswire. My question goes to Dr. Ryan on WHO's risk assessment for coronavirus disease 2019. Please correct me if I'm wrong, but I understand that WHO uses the word pandemic phase specifically for influenza outbreak cases. But should the global risk assessment of COVID-19, which is high now, turns into very high in the future, would it be safe for us journalists to say or call it pandemic in general terms? Thank you.
Yeah, I think we need to be extremely cautious in using the term pandemic. We had lots of controversies during the H1N1 situation around when it was pandemic and when it wasn't pandemic, and I think we need to be careful. The real issue here is whether we're seeing efficient community transmission outside of China. And at the present time, we're not observing that. And as such, we're not in a position to have that discussion. What we're seeing is, again, as we said previously, the majority of cases outside China have a direct link still back to China. And of that transmission that's occurred in countries outside China, the majority of that transmission can be traced through existing transmission chains. So therefore, I think we have to be very, very careful not to drive fear in the world right now, and be very cautious in using the words you have used. We've said it, the risk is very high in China, it is high regionally, and it's high around the world. That is not the risk is high of a pandemic. The risk is high that the disease may spread further.
Okay, I'm going to pause it right there. There's a word he doesn't mention, which is very accurate. It's an epidemic. Epidemic is something that's highly infectious. A lot of people are sick, and it's within a given region. Okay, why didn't he use the word epidemic? Okay, pandemic, according to the World Health Organization, this group, is something that's global, that's spreading global and has a high mortality, not high mortality rate of 0.01, 0.03%. Okay, that's what you can go to their website and you can find. Okay, he's not responding as a scientist, he's responding as a politician. Now, granted, I'll give the guy credit. He's trying not to create fear because there's a lot of fear mongers out there. Don't get me wrong. And news is full of fear. That's how they sell you advertisements. But the reality is that, look, a lot of people are sick and a lot of people are dying. And is it infectious? Is it highly contagious? Yes. If it wasn't, we wouldn't be having this conversation.
I think at face value, that is true. I don't know, Sylvie, you have a comment on this.
This is troubling. Listen to this one.
I think the difficulty with certain words is that their interpretation varies. And
really?
For general public, very often pandemic is really the worst case scenario. And so this
is what happens when you think with your emotions and not with definitions defined by a group. Okay? I deal with the UN all the time. There's key words that you have to define. In the World Health Organization, pandemic is one of them. Epidemic is another one. It's not how I feel. Does it fit the category? Does it not? I know she's a very well-respected person, don't get me wrong. She's highly educated, speaks multiple languages, has a lot of knowledge, but it's doing a disservice to people.
I think we need, before qualifying the event as the worst case scenario, we need a lot more evidence and a lot more data. And so that's why I think we need to be cautious, because it can really create panic unnecessarily, because what is important currently is that we all agree on the risk assessment so that we can all tackle the virus the same way.
Young with Xinhua News Agency.
Okay. She doesn't want to create panic. Worst case scenario, pandemic. Is pandemic really the worst case scenario? I didn't see that anywhere in the definition of pandemic. Why can't we just call it for what it is? That's all I'm saying. Now, if you go further on in this video, and I can take you guys longer, but you probably don't have much time, they talk about, hey, we know it's in China. It's a big problem in China, the region China. We know that all the problems that are associated with people outside of China that are getting sick have some link back to China. Oh, but by the way, don't profile, okay? Now, I understand we shouldn't be cruel to people, certain groups, but it's also wise not to hang around somebody that may have been in the region the last month, okay? And it's not because you don't like the person, it's because you don't want to give the sickness to your child. I think that's pretty fair, right? Now, in the meantime, I can't help anybody if I'm sick, right? So the best thing I can do is avoid public places, which they go on and on in this video about, should we avoid, cruise ships? Well, I don't want to say avoid cruise ships. Avoid any container that you're locked into with one septic system, and you have the weakest link is one chef cooking for the entire crew. If somebody in that kitchen gets sick, you're in trouble. That's all I'm saying. Okay? Avoid public transportation as much as you possibly can. Now, are you going to get sick if you get on public transportation? No. Okay? But the odds are, if you're going to get sick, it's going to be in an environment where you're tight and close to people, and you're basically quarantined for a small period of time. That's how you're going to get sick. But nobody wants to say that, because nobody wants to bring down the airline industries. Nobody wants to bring down the cruise ship industry. It's more about industry than it is about protecting people. This is what troubles me the most. When you guys get off the plane and they do those scanners, and those scanners, they look at you and they go, oh, look at the temperature of that person. It does 0 for you, okay? You can be sick for 2 weeks and contagious and not show a fever, okay? And those sensors that they're putting on there, aren't even that accurate. It's meant to make you feel good. That's my point.
A joint team of Chinese and WHO experts have begun field inspections on the outbreak on Monday. So up till now, any updates on their latest findings and next steps in the coming days? Thank you.
Yes, the team have had a series of face-to-face meetings with Chinese counterparts, and it's excellent to see such eminent international experts working side by side with their Chinese counterparts now. Much of the work over the last 72 hours has been in laying out and agreeing on what are those outstanding questions. We've been speaking about those unknowns, and it's agreeing what we know, agreeing what we don't know, and agreeing what is the best way to access the information of what we don't know. The team will then be able to go and visit provinces and see things on the ground and continue that work together. And again, we reflect on the fact that this is a collaboration between Chinese scientists and scientists from the international community, and it should be seen as such.
Yes, we will go online.
From Xinhua News Agency. My question is, the WHO advisor recently said that new coronavirus could infect 2/3 of the globe. Is still today a concern of the world.
Could infect 2/3 of the world's population.
This estimate.
No, it's not a pandemic. Don't worry about it.
WHO works with many people around the world, and people can express views on likely scenarios. Many of you have seen the various ranges of R0 or R0 that's been proposed, and all of that is important in generating hypotheses for possible scenarios in the future. But we dealt with this previously because we had some of the same predictions last week from other scientists. All predictions are important. Most predictions are wrong. And I think we need to be careful with that.
You're going to hear it real quickly, but their comm systems are horrible. Here it comes.
Hello? Can you hear us? That's not really okay. Now, let's maybe go back to the room here. We have a friend from Irish Times who joined us for the first time, and then we may go back online later. Please. Can I ask if the speakers have any doubts about the efficiency or the effectiveness of testing for the virus, given some anecdotal cases where people
Another
were
good question.
tested or they were found to
How
have
good is the testing?
positive?
You'd be surprised to see that there's big gaps in the
No
testing.
diagnostic test is foolproof. And we've seen that with screening programs and others around the world, especially when tests are new and validating those tests. So that there's always a small chance of a false positive or a false negative. Someone who's told they're positive when they don't have the virus, or sometimes someone told you don't have the virus and they subsequently turn out to have that virus. So it is an important consideration, and that's why
I'm going to pause this. Okay, so you don't just do one test, okay? You do multiple tests, and you look at the results of multiple tests. That gives you, you take one measurement. It's not gonna. You can't build a house off one measurement. You got to take multiple tests. Like anybody that develops a sensor in the world knows that a sensor has its limitations. Okay? That's all they're doing. So if you're just waiting for one test to give 100%, you're in the wrong business. You got to do multiple tests, and you got to do multiple different types of tests. This gives you the breadth of the gap analysis of is it showing up in one area and not in the other. So all I'm saying.
And intention to treat diagnosis is always very important. If there's an epidemiologic link with the previous case, and if the person is extremely ill and you get a negative test, we would always retest that patient. So the retest protocols and then validation of those samples in reference labs, especially where countries are testing for the first time, we require and ask countries to share their first 100 samples with an international reference lab so that we can validate their testing protocols. So there's a lot of checks and balances in place, but again, we rely on common sense. No test is foolproof, but what it does allow is busy clinicians and others to identify those patients who have COVID-19 and treat them accordingly.
We will try one more time to go online. We have someone calling us from Canada. Can we try? Can you hear it?
Yes, can you hear me? Yes, please, can you introduce yourself?
Yes, my name is Jean-Benoit Legault, and I'm with the Canadian Press in Montreal. There are reports that roughly 100 passengers have now been infected on board the Diamond Princess. What more can you tell us on that front? And if possible, I would like to hear Dr. Olina very briefly on this matter. Thank you. In French. Thank you. Your question is pretty good, Dr.
Yes, so on this issue, I think what is clear is that it's very difficult to make sure that the infection prevention and control measures are difficult to implement in a ship environment because there are a number of factors that are very difficult to be put under control, and we have seen this in many other occasions for other infections like for noroviruses or other type of infections. So it's not specific for COVID-19, and so that's why we are working very closely with the various constituencies, the Japanese.
Okay, I'm going to translate that from French to English. Cruise ships, any closed container is an incubator for you to catch a virus. She just said it. Doesn't matter if it's COVID ID, was it COVID ID 19 or another virus. Cruise ships are incubators.
Authorities, but also the chief medical officer on those cruise ships to see what would be the best measure to put in place to protect the people on the ships, but also make sure that we still stick to our objective, which is the containment of the virus. And I think this is what we are going to, that's what we are doing currently. Also be very cognizant that we need to make sure that we focus on our objective, public health objective, which is to contain the virus and not to contain the people, and making sure that we can have a right balance between the health of the population in Japan and other countries, but also the health of the people being currently on this boat. And so we need to have those balance. And it's currently quite difficult because there are still many unknowns on this virus. And so measures are implemented and assessed currently and monitored on a nearly hourly basis because we learn every day and every hour more about this disease and this virus.
Okay, to give Dr. Briard credit, she's probably the most honest person at that table.
Just like shorter version in French.
Okay, this time.
Now it's in French, we'll skip that one.
West Diamond, the Crown Prince, the Princess Princess, because they've been exceptionally open, transparent, and cooperative throughout this whole process, and that's something we deeply appreciate.
No, they need to, because if they
Thank
get sick, they're going to get sued.
Let's try to get Sarah Jerving from Devex. Sarah, can you hear us?
Yes, thank you. I just had a question about the reported figures. So in your daily updates, WHO is reporting laboratory cases, but at the beginning of this press conference, you used laboratory plus clinical cases.
I can only take so much of that voice.
Address this.
Thank you very much. Let's try to get quickly one or two more questions before we.
Here comes a good one.
Michael from CNN. Can you hear us, Michael?
I can hear you. Can you hear me? Yes, please go ahead. Okay, I'm Michael Biosecurity here. I'm a contributor to CNN. First of all, I'd like to salute you for your great information sharing efforts. I'm sure I speak on behalf of everyone that we're very grateful. Mr. Director General, at the beginning of the outbreak, you mentioned how important media are as partners and how important information sharing is. I'm sure you've read the same stories we have about video bloggers and others in China being arrested or detained or simply put under quarantine. And I'm wondering, given that kind of choking of information, if you will, whether you're prepared to address this issue with the Chinese authorities and remind them of how important during an outbreak like this is free flow of information, as long, of course, as it's accurate and verified. Thank you.
No, we always encourage and will always encourage openness. We say the same, and one of our own principles here is we don't, when we get misinformation, our job is not to go after the people who release misinformation. It's put out good information and give people the best information. So it's not about going after the messenger. We do encourage openness and transparency at all levels. It is the best way for public health to do its job.
So I just want you to notice, he didn't look at you or the camera when he was saying that. And so for me, when I see somebody not looking at me and they're hiding something, So this is very common discussion among media, press release people, government people. We want to report accurate information and we want to keep down the troublemakers that are disagreeing with us. Okay, I understand nobody wants to create, crap on the internet. But guess what? You guys aren't reporting the right numbers. Chinese government's not reporting the right numbers. So what are you doing to them? Okay? Why are you not calling it an epidemic? Okay, that's also fake news, in my opinion. It's my opinion. Okay? I own it. But no, just keep going and keep telling us that what you're giving us is 100% correct and Jeffrey Epstein committed suicide. But none of that gets blocked on the internet. Only when people speculate with facts and show that the guy was actually strangulated, was strangled with a wire, right? and they have all the biometric evidence to show that he was killed that way, you're the one that's the problem. This is the problem I have with blocking free speech. Do I hate misinformation? Absolutely. But I hate it more when it comes from the government and when it comes from these non-government institutions, right? Non-government organizations, NGOs. I hate it more.
And it doesn't matter what country you're in, it doesn't matter what level you represent. So openness and transparency is the way forward. And we do
Look at me when you say openness and transparency, please.
Quarantine ships. We always have to balance the public and common good against the rights of the individual. And sometimes that's a very difficult balance to strike. And that has been a historical balance to strike. And we've seen that in 1918 in the Great Pandemic, where governments, including your own in the US, had to make some very difficult decisions about quarantine, very difficult decisions about information sharing, and that is
sharing or limiting.
It's something that you can't ignore, and it's very important that all governments are able to balance the good of society and the community against the rights of individuals.
Okay. It's the government that's deciding on your rights, when you can use them and when you can't? Okay, whatever, dude. That's why you're in Europe.
To openly communicate.